Hi, I'm Emily Davis, student physical therapist assistant, and I'll be working with you today. Can you please tell me your name and date of birth?
Macy Adams, 03/02/1997.
And can you tell me what state we're in?
Ohio.
And what month it is?
July.
And do you know why you're here today?
More weakness in my hip muscles.
Okay, and that's correct. So what we're going to be doing is I'm going to have you side lying. I'm going to be working with you, and we're going to be abducting your hip. You'll have your leg facing the ceiling. Whenever you get on the table, I will be behind you, and I'm going to apply some pressure. It's going to be minimum, moderate, and then maximum resistance.
Okay.
We're just going to see how strong your muscle is. So I just have a couple more questions before we get you laid down.
Okay.
Do you know if you have cancer, or have you had cancer in the past?
Nope.
Are you pregnant, trying to become pregnant?
Nope.
Do you have any impaired sensation, like telling the difference between hot and cold?
Nope.
Fermentation seems good. Has the doctor told you that you should avoid range of motion in your hip?
No.
Okay, and there's no dislocation or fractures in the area that are not healed. If we have pain with this, we're going to stop treatment and get that figured out before we continue.
Okay.
Do you have any joint inflammation or infection that you know of?
No.
Are you on any opioids or narcotics?
Nope.
Do you have osteoporosis? Any blood clotting conditions?
Nope.
You're not hypermobile in your hip?
Mm-mm.
And this is not a new injury?
Nope.
And there's no new united fracture, like you didn't just get surgery in this area?
No.
All right. And you have not had it in like a sling or been in a wheelchair lately?
Nope.
And do you get fatigued or feel like you're overworked when you're going through some motions? All right, so we will go ahead and get started. I'm going to have you take your shoes off. I'll have you with this leg facing upright.
Okay.
Do you want a pillow to hold on to?
No, I'm okay.
Okay, we'll put this in between your legs. And I'm going to be getting behind you. So what I'm going to be looking for substitutions is if your hip starts to roll forward or backwards, and we don't want you to rotate your leg at all. So I'm going to be holding your pelvis.
Okay.
And I'm going to have you, the motion is going to be lifting up and then back down. So can you do that for me again? Okay. So the next time that we do it, I'm going to apply pressure.
Okay.
And I'm going to count, and we'll see how long you can hold it for.
Okay.
All right, can you go ahead and lift? All right, so here's min, mod, max. Okay, so I did not get you to maximum for 5 seconds, so we're gonna restart, and I'm gonna hold you at moderate, and we'll see if we can get to 5.
Okay.
All right, so go ahead and come up. All right, 1, 2, 3, 4, 5. Okay, that's good. All right, so is there any pain with that?
No.
All right, so that treatment is what we're doing for the day. So we're done with that. There's no pain?
Nope.
Everything feels okay?
Yep.
Do you have any questions for me?
Nope.
All right, I can go ahead and remove this from you. And you can sit up. If there's no further questions, I think we're done for the treatment for today.